to Bay Area Psychology. Over 150 million people in the United States suffer from pain, and over $100 million a year is spent in the U.S. for pain medication. So chances are that if you're watching tonight, you identify with the following indicators of chronic pain. 1. My pain has been present for more than 4 months. 2. I have been to at least 2 doctors for my pain condition. 3. I feel frustrated by my pain. 4. I am in pain at least 50% of my waking hours. 5. Sometimes people don't understand my pain. 6. I feel as though the pain is controlling or is beginning to control my life. 7. When pain increases, I become depressed or anxious. 8. I feel trapped by my pain. 9. Thinking about the future makes me nervous. 10. I'm afraid that the pain will increase. Tonight, we are fortunate to have San Jose internist Dr. Phil Mack and Los Gatos Marriage and Family Child Counseling intern Suzanne Jones with us tonight to talk with us about chronic pain and what we can do about it. Welcome to both of you.
Thank you.
Thank you. Okay. When you were listening to the list that I was sharing with the viewers, did it sound familiar to you in terms of the kind of people that come into your office?
Oh, I see it too many times in a day. I would say that it's probably one of the more frequent things that people present to physicians that come out of frustration, that they've had numerous attempts at temporary relief and that's failed.
Okay. So by the time they see you, they've probably been to several other doctors or perhaps have tried other types of interventions?
Multiple things. Usually not only other doctors, but they've tried many things on their own, talked to people, talked to friends, and very much by the time they get to me, they're exasperated.
Okay. And in terms of the psychology end, does that present itself for you as well?
Exasperation is one thing, but I think one thing that I see more often than exasperation is anger.
Okay.
Anger at being in the situation that you're in when you have chronic pain. And also you're dealing with depression, anxiety, a certain amount of frustration, exasperation.
Well, it must be very hard, too, in the sense that often what people present as chronic pain is not something that's evident to other people. You know, I'm thinking of people who present with maybe back pain or migraines, things that other people can't see. Maybe is part of that frustration trying to communicate that as real, trying to get validation?
Absolutely.
Okay.
Absolutely. And one thing that I notice when I do my pain groups is that people come to a group and they tell their story about where they are with their pain, and they immediately feel heard because other people there in the group have been there. They've walked all those various steps and finally gotten to a physician's office.
Okay. And I would imagine as a physician, is it common in the medical practice for doctors to understand chronic pain, or does it frustrate them as well?
Well, it's terribly frustrating because our education never focuses on chronic pain. Our education is always based on an acute pain model, which says somebody has a pain that is proportionate to the injury. Okay. And so that your treatment is based on the proportion of whatever you see as being injured. Okay. So a thumbtack or a nail in the thumb differs than a smashed foot or a crushed leg, and you use the appropriate amount of medication based on an acute pain model. For chronic pain, it doesn't work that way.
In fact, I would guess using an acute pain model, that's probably one of the reasons that addiction to medication can be a problem with chronic pain.
Well, more importantly than not only the addiction, but just simply not realizing what you're dealing with because the treatment is so much different. Rather than focusing on taking away the pain by giving a pill or a single treatment, it's multimodal, multifactorial that it usually involved by the time it becomes chronic.
Okay. And so part of your treatment in terms of your training has to do with, okay, the way I help people is to write this prescription maybe, if you're not a specialist in this area. And so you just would write scripts in hopes that perhaps you might actually be able to address the cause of the pain. And with chronic pain, that doesn't happen. It doesn't go away.
Well, it's not only, there's a co-frustration. You know, as physicians, we're trained to take people's pain away.
Right.
And the co-frustration is patients frustrated because they're still in pain, doctors frustrated because they're still in pain. which then usually escalates the amount of physician involvement. Higher strength of pain medication, more pills, and to a point where you don't want to see the patient anymore because it becomes a reflection on your ability to take care of them.
And that's part of the psychology of being in chronic pain, is that you learn after you've been in chronic pain for a few years that going to a physician and taking a pill is not going to take away your pain.
Okay.
You have to rely on other things other than pain medications. And one of the things that I use primarily in my own chronic pain and with those in my groups is relaxation.
Okay.
And coming to an acceptance of the pain and beginning to live with it successfully.
So rather than having a fighting model, I mean, I think culturally we're taught, what comes to my mind is pulling ourselves up by our bootstraps. We're supposed to somehow get on with this. I mean, I've certainly heard that with depression. For clients, I'm supposed to just get over this, you know, whatever's bothering me.
Right.
Now, we do have a graphic on the different characteristics of somebody emotionally who might be struggling with this that we could take a look at, and maybe you can comment on. Characteristics of chronic pain sufferers. We have depression, repression, anxiety, self-demanding behavior, tension, or perhaps even dependency. And I'm wondering if any of those sound familiar to you. I was particularly interested in kind of that self-depending kind of behavior, that wanting to do it myself.
That's very strong in people, and I think wanting to do it yourself is a very good asset. I think that too often we do depend upon going to doctors and looking to them to take care of us, whereas if you've been in chronic pain, I know, for example, my records are in at least 3 counties and with several physicians and several physical therapy places. So I think, just to quote a doctor one time about my own frustration, he said, "You feel like nobody's driving the boat." And I said, "Absolutely." And at that time, I began really keeping a monitor, a very close check on where I had been, what doctors I'd seen, what medications I took, how often I took them, and what they did.
Okay.
And really making my own chronicle.
Okay.
Being
so
in charge.
Then, yeah, that's right, then being in charge.
Yes.
Now, I have heard you speak on a number of occasions, Dr. Mack, about this being in charge component, and I'm wondering if you would share some thoughts about that.
Well, from my experience in dealing with the people, it's bums don't get this disease. The people that proportionally get it are high functioners, people who were in control of their lives, and one characteristic that John Bradshaw talks about is the superhuman person.
Okay.
The person who tries to do it all. And then suddenly something, often minor, tends to get them into the chronic pain realm, where they're relieved of all this super ability and become exactly the opposite in a very dependent state, which is very foreign to them. And we don't like being in that state, and we want to pull ourselves back out to once again get back to that state of being in control and in command and being able to overcome whatever adversity we have, you know, trying to overcome it
Okay.
rather than deal with it.
Okay, so then some of the emotions that we see here, depression or anger, even anxiety, may have to do with that struggle then.
Those emotions that you mention are part of the grieving process that goes with chronic pain. I think grieving and loss are the 2 most outstanding features of chronic pain. And it's working through all the steps of grieving that finally brings you to an acceptance of living successfully with your pain.
So seeing it as, again, something that you take as part of you rather than this outside invading thing that has happened and somehow I need to conquer it.
Yes, in fact, many times people with chronic pain will tend to mentally amputate that part of them that is painful. It's not okay. You'll ask them to picture themselves as a whole and picture the part of them that's hurting, and you'll find that in their image that part is black, or it's red, or it's ugly, or it doesn't even exist. So we have to accept that part back into us and be okay with that part
Okay.
to come to acceptance.
And when people come into your office, at what phase of acceptance do you usually see? I mean, I imagine you still get them in the conquering or
I
struggling
get them in the
stage.
very early phases, usually,
Okay.
of being extremely angry, hostile, and most of the time I get, at least at the beginning, a lot of the hostility about the medical care they've gotten. So rather than even dealing with the pain level, they're dealing with the frustration of being inappropriately, or from their point of view, inappropriately treated, to get them to that situation. So we have to get beyond that to where they begin to feel like they have some command or power over their own destiny, to
Okay.
get them into a better place of working through it. And usually that involves a lot of anger. There's
Okay.
a
Yes.
considerable amount of built-up anger and hostility about just the being in the situation they're in and the treatment that they've gotten.
How is that for you? I mean, I'm picturing all of a sudden, 6 or 7 hostile people coming into your office in the morning. How is that for you?
You have to develop a certain kind of sense of allowing them to ventilate, knowing that that's what they have to do. One technique is to just pretend like you're a screen door, and
Okay.
that this is just flowing through you,
Okay.
and not take it personally, or that you're a reflection of the profession in general, but that the ventilation is actually part of their healing process that they just need to get through.
So you can see that for yourself as part of the very needed treatment that they need to receive.
True.
Okay. We're going to take a quick break. When we return, we will learn more about techniques for controlling our pain. Stay tuned. When we left, we were talking about different kind of emotions and frustrations that come up for people struggling with chronic pain. And the only one on our list we haven't yet discussed is repression. And I know that's a psychological term, and I'm wondering if one of you would be willing to explain that to our viewers.
Repression is simply not acknowledging a feeling.
Okay.
And many times we feel that our feelings are not okay, so we repress them. We don't allow them to come out.
Okay, so one of the things that I might experience if I had chronic pain was to sort of cut myself off from awareness that it was really a problem. Mm-hmm. And maybe if there was an injury, not be treating it in the way I needed to treat it, or something like that?
Well, or to repress your need to give yourself permission to take care of your pain.
Okay. So then maybe tolerate more pain ongoing than I might need to? Because I'm not addressing it?
That's true. That's
Okay.
true. You have to be very proactive in taking
Okay.
care of your own chronic pain.
Okay. So you were mentioning during the break, in terms of types of people that might be more prone to developing a vulnerability to chronic pain.
Well, in the when I was using or opened up a chronic pain treatment in an inpatient setting, of the 190 some people that we admitted, almost 100% of them came from severely dysfunctional families, yet they were very high achievers. So the combination of not only having a significant amount of previous psychological trauma, but they were also very adept, very accomplished in their fields. Mm-hmm. And in that sense, I think you could predict those who would be more prone to eventually develop chronic pain in some way.
Okay, because maybe they're pushing themselves harder.
Not only pushing themselves harder, but they were people that didn't have the sense of how to enjoy things as much. They were much more driven, much more unable to tap that side of them that got a lot of pleasuring or pleasurable behavior.
Okay. Okay. So in one, go ahead.